Welcome, everyone. Let's jump right into the hidden costs of alcohol and its massive impact on global public health. It's crazy when you think about it. Alcohol is not just a casual drink, it's a true toxin on multiple levels.
Absolutely. It's like there's more under the surface than just a fun night out, right?
Exactly, check this out. Alcohol accounts for over 3 million deaths every year globally. That's why it's ranked as the seventh leading risk factor for death. We're
Yeah.
not just talking about acute intoxication, it's a chronic drain on health.
And that's tied into those disability adjusted life years, right? Alcohol leads to about 5.2% of all dailies worldwide.
Right. Those DALYs are a measure of both premature death and the burden of chronic diseases. It's not just about dying early, but also living with long term illness and disability.
So basically, alcohol is like this silent epidemic in the background.
Yes, and what's even more striking is how the so called safe drinking myth has led people astray. People often tout that a glass of red wine might be good for you, but recent evidence says there's really no such thing as a safe level.
Uh
Even
huh.
one drink can up your risk for cancers and heart issues.
That's wild because for years, moderation was touted as a sign of a healthy lifestyle, wasn't it?
Exactly. It's like you might think a single drink is harmless, but studies have repeatedly shown that even minimal consumption raises the risk for several serious conditions, from cardiovascular disease to cognitive decline.
I've even heard people say that moderate drinking can be part of a balanced diet. But with the science pointing to harm, it looks like that's really a myth.
Precisely. And it's not just about the immediate effects. Alcohol is a neurotoxin, it messes with brain communication pathways, affecting judgment, coordination, memory, and even emotional regulation. Chronic
Yep.
exposure leads to long lasting changes, notably in the prefrontal cortex, the brain's command center.
So we're talking about structural brain changes here, right? That sounds like a recipe for long-term mental health issues.
Absolutely. Studies even show that alcohol can trigger neuroinflammation that persists long after you stop drinking. Think of it like rust building up in an engine. Over time, it seriously impairs how things
Yeah.
run.
And it's not just the brain, is it? What about the effects on the heart and liver?
Right, let's talk heart. Heavy drinking is a major risk factor for cardiomyopathy, arrhythmias, and strokes. Earlier research hinted at potential cardiovascular benefits from modest amounts, but more recent findings suggest those benefits are marginal
Mm-hmm.
at best. The risks far outweigh any potential perks.
I mean, it sounds like even if you think you're keeping it moderate, the cumulative damage is significant.
Exactly. And then there's the liver. Alcohol is brutal there. Chronic use leads to fatty liver, hepatitis, fibrosis, and even cirrhosis. In some cases, patients need liver transplants. In the UK, alcohol related liver disease deaths nearly doubled in a couple of
Yeah,
decades.
that's alarming. And the damage to the pancreas isn't any better, right?
Right, you are. Alcohol prompts the pancreas to release toxic compounds that can lead to pancreatitis, a painful, sometimes life threatening condition. It's like putting toxic stress on every organ that's supposed to be helping you process what you ingest.
Speaking of toxic, it's interesting how alcohol is classified alongside notorious substances like tobacco.
Precisely. The International Agency for Research on Cancer classifies alcohol as a Group 1 carcinogen, which is pretty much the highest risk rating. It's in the same category as tobacco and asbestos. Even one drink a day can ramp up your cancer risk, from mouth and throat cancers to even
Hmm.
breast cancer.
That alone is enough to make you rethink that routine drink, don't you think?
Absolutely. And there's more. Alcohol, it's also linked to mental health and neurological disorders. Long term use has been tied to mood disorders, memory loss, even dementia. It creates a cycle of depression and dependence that can be hard to break.
I get that. Chronic alcohol use not only messes up your body, but it also unravels your mental well being.
Exactly. And this is where it starts to impact society. Beyond the personal toll, alcohol misuse fuels domestic violence, traffic accidents, workplace injuries, and the overall economic burden is staggering. For instance, in the US, it costs around $249 billion dollars annually when you add in lost productivity, healthcare expenses, law enforcement, and more.
Yeah, wow, sounds like a ripple effect that touches every aspect of life.
Definitely. And then there's the unfortunate policy gap. Even with global strategies in place, like the WHO's global strategy to reduce the harmful use of alcohol, progress has been slow. Economic interests and weak enforcement have really hampered efforts to bring these harms under control.
Hmm. It's almost like the industry itself is fighting against meaningful change.
Exactly. And the whole notion of responsible drinking promoted by these industries actually muddies the waters. These campaigns often mask the risks and delay stronger regulatory actions.
Uh-huh. But wait, sometimes people argue that it's about personal responsibility. Isn't it a bit too aggressive to impose heavy regulations if it's an individual's choice?
That's a great point, and I respect that perspective. However, when you consider that alcohol's cost isn't just personal, it's a huge societal burden impacting families, healthcare, even national economies, it becomes clear that the
Mm-hmm.
risks extend far beyond individual choice.
I see your point. It's like the decision of one person ends up costing society a pretty penny.
Exactly. And we also have to think about the vulnerable groups like youth, pregnant women, and those with existing health issues who are disproportionately affected. Alcohol during pregnancy, for instance, can lead to fetal alcohol spectrum disorders that cause lifelong developmental issues.
Right. And the damage doesn't stop there. Exposure during early development can seriously undermine brain growth later on.
Spot on. Plus, during the pandemic, many places saw alcohol consumption spike dramatically. England, for instance, experienced a 20% increase in alcohol related deaths between 2019 and 2023.
Wow, that's a drastic uptick. It just blows my mind how something so normalized in society carries such catastrophic consequences.
Yes, it's a silent crisis that needs urgent attention and, frankly, a complete rethinking of cultural norms around drinking. From public policy and economic incentives to individual decisions, a systemic shift is necessary if we're going to tackle this effectively.
And it boils down to a call to action for better education, tougher regulations on marketing and sales, and really just shifting the way society sees alcohol.
Exactly. Every drink is a roll of the dice. And when you look at the evidence, it's not a gamble worth taking. We need both personal commitment to healthier choices and policy level changes to address this issue
Uh-huh.
head on.
This really brings the conversation to a head. It's like we're at a crossroads, and the choices we make at an individual and societal level can either reinforce or dismantle these harmful norms.
Absolutely. And while we all love a good social scene, it's important to ask ourselves, is that temporary social buzz worth the long term, hidden toll on our health and communities?
Definitely food for thought. More than just another debate over personal freedom versus public safety, it's about the quality and length of our lives, isn't it?
Exactly, and that's why it's so crucial that we keep having these conversations, keep pushing for better policies, and encourage responsible choices. The time for complacency is over.
Agreed. And while change might come slowly due to entrenched interests, spotlighting these issues is the first step in spark change.
Right, and the more awareness we generate, the harder it will be for industries to justify misleading narratives that undermine public health.
Yeah, absolutely. It's been a really eye-opening discussion. Makes you wonder how cultural norms can be so entrenched that we overlook such profound costs.
For sure. And let's hope this kind of dialogue can drive both individual reconsideration and systemic change. Remember, every choice counts.
Well said. Thanks for breaking down these complex issues so clearly. This definitely gives us a lot to think about.
Absolutely. Thanks for the engaging exchange. Cheers to a healthier future, one thoughtful step at a time.